What is hypertension? Before we talk about it, first, let's take a quick review about blood pressure. So, what is blood pressure? When your heart beats, it pushes blood around your body to give it the energy and oxygen it needs. As the blood moves, it pushes against the sides of the blood vessels. The stress of this pushing is your blood pressure. So blood pressure is a measurement of the force against the wall of your arteries as your heart pumps blood through your body. Every blood pressure readings consists of two numbers or levels. They are shown as one number on the top of another. For example, your blood pressure is 120 over 80 millimeters of mercury. What do these two numbers mean? Well, the first number is called systolic blood pressure. It is the highest level your blood pressure reaches when your heart beats. And the second number is your diastolic blood pressure. It is the lowest level your blood pressure reaches as your heart relaxes between beats. A blood pressure below 120 over 80 is optimal. It means people whose blood pressure at this level have a much lower risk of heart disease or stroke. Blood pressure readings in the range from 130 over 85 to 140 over 90 is called high normal. If your blood pressure is within this range, you should be taking steps to bring it down or to stop it rising any further, because the higher your blood pressure, the higher your risk of health problem. If your blood pressure readings are consistently 140 over 90 or higher over a number of weeks, we call it hypertension. So, hypertension has been defined as an usual blood pressure of 140 over 90 millimeters of mercury or higher. It is a chronic medical condition in which the blood pressure in the arteries is elevated. This requires the heart to work harder than normal to calculate blood through the blood vessels. And hypertension can be divided into three stages according to the blood pressure readings. Stage 1 hypertension is described as patient with systolic blood pressure between 140 to 159, or with diastolic blood pressure between 90 to 99. Stage 2 hypertension means patient with systolic blood pressure between 160 to 179, or with diastolic blood pressure between 100 to 109. And patient with systolic blood pressure higher than 180 or systolic blood pressure higher than 110 is called stage 3 hypertension. For example, if somebody's blood pressure is 150 over 116, well, we can see that although the systolic blood pressure is in stage 1, but the diastolic blood pressure is in stage 3, so this man will be considered a stage 3 hypertension. Also, hypertension can be classified as either essential hypertension or secondary hypertension. Essential hypertension indicates that no specific medical cause can be found to explain a patient's condition. About 90 to 95% of hypertension is essential hypertension. Secondary hypertension indicates that the high blood pressure is a result of another underlying condition, such as kidney disease or tumors. There is no guarantee that a person with hypertension will present any symptoms of the condition. About 33% of people actually do not know that they have high blood pressure, and this ignorance can last for years. For this reason, it is advisable to undergo periodic blood pressure screening even when no symptoms are present. However, extremely high blood pressure may lead to some symptoms, and these include severe headache, fatigue or confusion, dizziness, nausea, problem of vision, chest pains, breathing problems, or irregular heartbeat.